To know about that. Now we move on to grief reaction. Now there are 5 stages of grief, and this in this aspect, there is a reason why we're going over this, and it's because for grief reaction, sometimes when you see it in elderly people who maybe they've lost a spouse, maybe the husband has lost a wife, or you've lost a partner, there is a tendency for them to become withdrawn. There's a tendency, probably, they start having hallucinations. They don't talk to other people. They think they are seeing their spouse or they are talking to their spouse, and then they neglect themselves. It's another situation whereby if the person who is experiencing grief is brought into the hospital, maybe by a relative, a son, a daughter, a nephew, and they are complaining that they won't eat, they won't take care of themselves. It's another situation where you can actually use the Mental Health Act to keep the patient in the hospital for at least 24 hours. Now, back to the stages of grief. So, the first stage is denial, followed by anger, followed by bargaining, followed by depression, and then acceptance. So in the denial stage, they do start having pseudo hallucinations where they think they are hearing voices or they are seeing their loved one. And this is a little bit worrisome. It does happen, but in some cases, like I mentioned, in the elderly, it can be a little bit worrisome. Um, you also want to watch out if the person at the initial stage doesn't grieve, and then maybe the grieving happens later on. So that is what is known as abnormal grief. And then the other is when the grief is prolonged. Usually, this cycle of the 5 stages of grief happens within a space of 12 months. But if it continues beyond 12 months, then that's the part that it should be worried about.